Doctor, can you explain PTSD, maybe what's going on when someone is experiencing that, and how hyperbaric oxygen has been very successful for the treatment of that?
So PTSD, relation to traumatic event that after that event, patients may experience difficulties with how they deal with similar type of experiences, where they may get rumination over rethinking what caused that traumatic event, which in turn causes problems with their cognitive abilities, their think, focus, concentration, or it can affect moods to where they're becoming anxious, depressed over what has gone on. Depending on the event, some patients such as veterans that might have been deployed, they have guilt over what occurred during their time in the military. Now, the PTSD usually occurs anytime after that event, and this can be months to years afterwards. And so current treatment that patients may seek through their doctors, often the doctors are trying to treat the symptoms, such as depression, anxiety, and oftentimes those medications might not work. Now with hyperbarics, we're trying to treat the condition by reducing the cause of the inflammation with hyperbarics. If we can treat that earlier, the better, but we've had success treating patients years afterwards that they've had post-traumatic stress disorder.
So when we're dealing with issues of the brain, talk a little, this might be going in the weeds a little bit, talk about the difference between a concussion, when someone suffers, an impact type event, versus a PTSD, and is that different in terms of what happened in the brain?
In a way, they're similar. So with a concussion and traumatic brain injury, part of the effects can be mental stress disorders such as anxiety and depression. Now with PTSD, that can be part of a prior head injury, traumatic brain injury, but for some patients that haven't had that head injury, you're still getting the smaller changes in the brain that causes that inflammation, the alteration of brain chemicals, which then kind of spirals down and affects your entire body functioning.
So you mentioned PTSD can be successfully treated. Again, each patient is different, but can be successfully treated with hyperbarics years down the road. What does that say about what that condition is actually doing in the brain? It's just, it doesn't heal itself, right? I mean, people can suffer for years with this before getting any treatment, and nothing is healing by itself in the brain, right?
Correct. So the patients that seek treatment after they've had symptoms for so many years, what's nice about the hyperbarics is if we can intervene, change that brain chemistry, the gene makeup within the brain that allows for the healing of the brain, that's where they notice that their symptoms may improve. Now, it is a process. It's not like flipping a light switch that only doing a few treatments they're going to get benefits. Typically, we're looking in the range that it could take several treatments as close together as possible, sometimes in the 20, maybe 40 treatment range to clear symptoms or at least improve their symptoms so their quality of life improves.